ladies and gentlemen, welcome to Global Health. This is your host, Dr. Yavuz Selim Salai, physician, entrepreneur, and venture architect. I promise you to bring people from all walks of life. Today, I have one of the top breast cancer specialists, oncology specialists, as well as internal medicine specialists in one of the largest hospitals in Ankara Bilkent City Hospital, Professor Dr. Didem Şener Dede with us. She's an amazing person. Many of us know her very well. We're so excited to have her. And you know, today is a very important day, and especially this month of October is known as the Breast Cancer Awareness Month. And she was kind enough to join us to talk about breast cancer, which is a very important problem. 1 out of 8 women has some type of breast cancer in certain life periods. So that's why what she's going to explain us is extremely important. We are so excited to have her. Professor Dr. Didem Şener Dede, welcome to Global Health.
Hello, Dr. Salai.
How are you today?
Fine, and you?
Thank you so much. I know you very well, but for our viewers, who is Professor Dr. Didem Şener Dede?
My name is Didem Şener Dede. I'm a medical doctor. I'm professor of internal medicine and medical oncology. I'm studying in Ankara Yıldırım Beyazıt University Faculty of Medicine and Department of Medical Oncology. Also, I'm working in Ankara Bilkent City Hospital Medical Oncology Department. This hospital is the largest hospital complex of the Europe.
Yes.
And we are assessing and planning the treatment more than 300 cancer patients a day in that center.
A day, it's a huge
yes.
Number, yeah.
A huge number. My special interest is breast cancer.
That's great. We're so excited to have you, especially in the month of October. I think you're the right person to speak to for our viewers in Africa. This show has been watched by more than 1 billion people across the globe, and we have about 50 million households which are watching this show. This is one of the top shows, so we are so excited to have you at Global Health.
Me too.
Thank you. So tell me a little bit about what is breast cancer and how does it actually develop?
Yes. Breast cancer is a malignant tumor.
So it's like a cancer, a malignant tumor.
Yes, it's malignant tumor. When we are talking about a malignant tumor, it means, and breast cancer I mean, arising from the mammary glands and mammary milk duct. A malignant tumor means a group of cells that grow spontaneously and out of control. These tumors are different group of tumors from benign tumors, benign tumors, I mean benign disease of the breast, nodules and cyst of the breast. Malignant breast tumors are dangerous and life-threatening tumors.
I see. We have many ladies who are watching this show actually, and can you tell a little bit about what are the most common symptoms of breast cancer? And as a lady watching this show, what should they pay attention to?
Dr. Salai, it's so much important point. The most common symptom of breast cancer is a palpable mass in the breast. The mass often grows painlessly. In addition to feeling the mass, findings such as indentation of the nipple, skin shrinkage, thickening of the breast skin, and orange peel appearance of the breast skin, and mass in the axillary armpit region are the symptom of breast cancer. Women should be careful about whether they have such a situation in their body and breast.
I see. So self-examination is obviously very important. So who is more likely to develop breast cancer? Like age, genetics, or lifestyle, do you think those can affect developing breast cancer?
Yes. This is again an important point. One of the most important risk factors is age. Breast cancer increases with age. Most cases occurs after age 50. Additionally, some genes that cause cancer development, I mean gene mutations have also been identified. However, the frequency of these genes, genetic mutations is up to 5 to 10% of all breast cancer cases. Most breast cancer cases, we cannot demonstrate the genetic mutations. Another risk factor is family history of breast cancer. Having people in first degree relatives with breast cancer, such as a woman's mother, sister, and daughter, increases the risk of breast cancer occurrence. The other risk factors, we can list the other risk factors as early menstruation and late menopause, use of hormone replacement therapy for more than 10 years, alcohol consumption, cigarette consumption, and obesity.
This is amazing. So there are so many factors that we should pay attention to. I'm glad you're sharing this with our viewers because, many of us, we don't pay attention to these early signs. And if we can diagnose early, I think we can treat early. But from your perspective, why is early diagnosis so important? We keep hearing that early diagnosis, definitely check with your physician. And once diagnosed, how does the treatment process progress for someone diagnosed at an early stage compared to someone at a later stage?
Yes. This is again a very important question and important point to pointing the truth. When we look at cancer types in general, we see that the characteristics, behaviors, and treatments of cancer types are different from each other. Mm-hmm. When we look especially in breast cancer, this cancer is a type of cancer that can be fully treated at a very high rate of when diagnosed early. So early diagnosis really saves lives when we are talking about the breast cancer. When we detect an early breast cancer, early stage in breast cancer in a woman, we have techniques that can cure that woman. These treatment techniques are chemotherapy, surgery, and radiotherapy. By looking at the molecular characteristics of the patient's breast cancer subtypes, we can make the most accurate plan and treat the patient by using one or more of these techniques. Another important point is, after the patient regains her health, follow-up should continue at regular intervals, lifetime.
Interesting. So definitely it is very important to diagnose so we can treat and actually have a better outcome. So what can be done to detect breast cancer early? Like, how can women who are watching us right now perform a breast self-examination, and how often do you recommend they do these self-breast examination from your perspective?
Okay. In order to detect breast cancer in an early stage, we use three methods. One is mammography. It is very important for women to have mammography at regular intervals, every 2 years after the age of 40. Other is clinical breast examination once a year for lifetime, starting from the age of 20. Another method is breast self-examination. Mammography and clinic breast examination, Dr. Sly, by a healthcare professional can only be performed in a healthcare institution. However, the breast self-examination is a method that every woman can do at home. It is so simple and easy and cheap. Breast self-examination can be performed a few days after the end of each menstrual period. When you are doing breast self-examination, you should stand in front of a mirror and first look at the breast to evaluate whether there is any deformity, asymmetry, or thickening of the skin. Then the examination is performed by pressing lightly on the breast with fingertips and circular movements. Axillas, armpits, should also be examined. You should do the same examination while you are lying down. And if you feel any suspicious symptoms, you should definitely consult a healthcare provider without wasting time.
I think this is really important because many of my patients, they examine only their breasts, but not their armpits. So it is so important to do a thorough examination. And as soon as they find anything, to consult an expert like yourself.
Yes.
I think this was great. I really, really appreciate your amazing explanations, right to the point, about breast cancer, how it develops, the most common symptoms, as well as why early diagnosis is important. Now, I think our viewers have a much better understanding, and we truly appreciate, on behalf of my team here at AFROTURK TV, for welcoming and joining us in this show. Thank you so much, Dr. Dede.
Thank you. You're
Take
welcome.
care and
You're
see
welcome.
you soon. My
You're
pleasure, my pleasure. Ladies and gentlemen, as you have seen, we touched on a very important point from one of the top experts, Professor Dr. Didem Şener Dede. She is actually working in one of the largest hospitals in Europe, and she has provided very important tips for us. Actually, we will do another episode as well soon about, you know, what is the story around the globe and the realities behind breast cancer. So I'll see you in our next episode. This is Dr. Selim Sılay, your wonderful physician, and always welcoming you to this show at Global Health. Again, I want to thank you for your huge interest. We're receiving so many WhatsApp messages about this show. Take care and all the best. Bye.